Good morning, my name is Andrew Nee and I'm the Palliative Care Coordinator for St Mungo's homeless charity and housing association. Welcome to our chat today. I'm here to discuss with you around advanced care planning for those who are experiencing homelessness and a project that we have been doing for the past 2 years with the charity Compassion in Dying that provides support documents to those who are palliative or at the end of life. Now, what we discussed and what was born from this collaboration project is the need to tailor advanced care plans to those who are experiencing homelessness, as there is a definite difference between priorities from the general population and the homeless population. Now, we came to create a project to see if we can tailor a specific advanced care plan for those individuals experiencing or have been affected by homelessness, and how their views or what their priorities are, what is important to them, can be different from the general population who would go through this normal process and have plans available. So what we did, the aim of the project was to learn from St Mungo's residents about their experience and priorities around advanced care planning, capability building to inform residents, staff and volunteers about advanced statements and the importance of planning ahead, to facilitate discussions to explore residents' preferences for healthcare and treatment with a focus on the advanced statement, provide one-to-one support for those who request it to complete an advanced statement, and produce an advanced care plan resource alongside residents tailored specifically for individuals affected by homelessness. Now, how we approached this was that we operated within 2 of our care homes within the organisation, where Compassion in Dying led the way and came in and provided sort of workshops for our staff as well as the clients and residents at the project. Now, what they did is that they brought them all together and went through what an advanced care plan is, and also discussed how this can help them to plan for the future if their health deteriorates. There was a number of workshops created that involved the residents very much throughout this whole process. And what it was is that it sort of shed light on their own experiences and their own priorities into what is important to them if they are terminally ill or have deteriorating health, or are palliative care or at end of life. There was quite a lot of good engagement from this, and from that it stemmed to more one-to-one engagement with our residents. So one of the Compassion in Dying lead workers on this project came in and met with residents on one day of the week to go through their individual needs and work through the document with them. What this bore out was that the wording of the advanced care plan that Compassion in Dying was tailored very much to the general population and people that had very much an idea of what their needs and wishes were, and were able to articulate it a lot better. Now, from this, the workshops and the one-to-one support feedback from that was able to provide guidance on how we can tailor the new advanced care plan and how it can be worded differently to reflect what these individuals' needs and wants are. From this, it was a collaborative process. We also worked with the staff at the care home as well to sort of like inform them, encourage them to actively work with our residents around advanced care plans, to discuss the needs and wants, and not so much focusing on end of life or if they become terminally ill, but sort of bringing in this type of questioning or these questions and guidance to really understand our residents and to really understand what living well would look like for them if their health became bad and if it deteriorated. This had a really positive effect as it sort of like cultivated a language and culture within the staff and within the residents, and they became more open and free about their experiences, what was important to them and what was living well like for them as well. And from these conversations, we were able to tailor the new working document of the advanced care plan to reflect individuals who have been affected by homelessness. So the wording changed slightly, there was different priorities, there were different wants and needs, the structure of the document changed, where there was more medical information and more medical posed questions, that was completely removed, as we felt that it was actually taken away from the residents' experiences, and also the wording was slightly confusing with how they would approach or answer that question. So things changed, the process carried on over time, the plan adapted, and I do have an example of this to share with you today. So what we have here is the main thing, which you may have noticed, is the change of the actual title. Instead of it being an advanced statement or advanced care plan, we really focus on my health and the future. Now, it has got the element of an advanced statement in there, but it's sort of really focusing on that quality of life and making or prompting individuals to really think about what their care will look like in the future if their health becomes unmanageable or they can't articulate or voice their concerns or their wants or their wishes. So we went through the document, trimmed it down, made it very sort of plain language, easy to understand, easy for staff and clients to work through as well. And it really hones in and focuses on the individual, such as things like the things I would like you to know about me. And what we had when we went through the actual process of one-to-one support was really interesting facts and interesting stories about our client residents that we support. And this bore out these sort of prompting questions, such as something that you're proud of or feel you're good at. Do you have a job or hobby that you enjoyed? And then it progressed through, it sort of changed the language of the document and made it easier to understand and easier for staff to sort of have these conversations. Now, this document itself is work in process, and we are sort of trialing it with other clients and residents within care homes, within our hostels, to really get an understanding whether this really helps and is able to help people think about their care and the future going forward if their health was to deteriorate. So really key points have been kept in context with this. So the treatment, things that are important to know about their health, things that they would prefer not to happen to me, sort of the real key questions of would you prefer not to be taken into hospital, all still remain. But as you can see, it's a very streamlined document, and it's very much focused on that building relationship between staff and also residents as well. Now, that we felt this to be fundamental, as one of the barriers that came across from this project was where it says advanced statement or advanced care plan. It was seen to be sort of a trigger for some people, as they didn't want to talk about or they didn't want to address if they had a terminal health condition, or if they felt that, or if they knew that they were going to die. So really focusing on their health, how it affects them at the moment, but also incorporating facts about the future and how they can collaborate and work and respect their wishes, which is the key point, and how we want to provide dignity and care with all our clients, all our residents across the organisation, especially those that have been experiencing or have been affected by homelessness. So the project is still ongoing. We really think that this is making moves forward to address the inequalities of care in the homeless population, especially when it comes around to palliative and end-of-life care. Now, these are steps forward. There's feedback from other staff that have used this document and said that the power that the title of My Health and the Future has such a resounding effect and has such a positive impact on those they are supporting who have terminal illnesses, that has cultivated and encouraged very powerful conversations with them and is not seen as a barrier. It also has the positive effect of making staff feel comfortable to have these questions and to go through what is important to the client, what is important to them, who they feel are important to them, and how they want to be treated and cared for. As I said, this project is ongoing and it is coming towards the end, and we will keep you updated. But it's really to highlight that in the palliative care world, in the palliative care profession, all the things that we do for the general population, we really have to tailor our support and guidance for those who have experienced homelessness or are still affected by homelessness, as their priorities are always different. Now, that could include substance misuse, whether it be opioids, other substances, alcohol, mental health is a factor, and also their priorities are always going to be different to, say, someone who is in their 70s and has a strong family network around them and knows their care and knows their wants and their needs. So this is a way to sort of not only understand or prepare clients for when they approach that time, but to build and strengthen relationships between them and the resident and the residing staff as well. So it's really to just give you an idea of what is happening at the moment, as I know quite a lot of hospices within the UK are working and striving to provide that quality of care to our clients and those who have experienced homelessness, and bridging the gaps and building that good relationship with project staff that have this issue as well. So that's the end of my talk. If you have any questions, you can give me, you can email me at andrew.nee, that's KNEE, @mungos.org. And thank you very much for your time. And hopefully this has been very helpful and informative. Thank you.